Hello everyone, this is the video for chapter 7 on autism spectrum disorder or ASD. Go ahead and pull up my notes chapter 7 PowerPoint. You'll see the first slide has this week's homework. You have 3 different assignments to do by Sunday night. You'll have a discussion board. You'll need to start on Wednesday and get that completed, and then of course your post to your peers by this weekend. Make sure you do what you need to do on those. First thing I want you to do is go ahead and watch the slide that's from a newscast about autism on the rise. So go ahead and pause this video, go ahead and click the Autism on the Rise by YouTube and go ahead and listen to it and then come back. All right, some of the chapter objectives on here. You'll be able to describe and defining features of an autism spectrum disorder or ASD diagnosis. You'll be able to explain how some of the behavior characteristics of ASD can become assets for the child as a learner. List factors that might account for the enormous increase in the prevalence of ASD in recent years. And then to be able to describe how etiologic theories and the search for causes of autism have changed from the first report of the disability into today. Along with that, you will see explain why the development of valid and reliable tools for early screening and diagnosis of ASD is so critical. You'll be able to briefly describe several evidence-based strategies for teaching students with ASD and specify what distinguishes them from the unproven faddish approaches. This would definitely help you in the classroom. And list some advantages and disadvantages of providing educational services for children with ASD in the regular classroom. Let's see here. Next, you'll have an IDEA definition. Autism is a developmental disability affecting verbal and nonverbal communication and social interaction. Generally evident before age 3, that adversely affects the child's educational performance. I'm going to go ahead and move this video here a little bit. All right. Other characteristics that are engagement in repetitive activities and stereotype movements, resistance to environmental change or change in daily routines, and unusual response to sensory experiences. Autism does not apply if the child has a serious emotional disturbance. That was the IDEA definition. The DSM definition has 2 slides here. Subsumes all 4 related disorders into a single diagnostic category. Autism spectrum disorder with the following characteristics. Persistent deficits in social communication and social interaction across context. Restricted repetitive patterns of behavioral interest or activities. Along with symptoms must be present in early childhood. Symptoms cause clinical significant impairment in social, occupational, or other important areas of current functioning, and symptoms are not explained by intellectual disability or a developmental delay. The characteristics, you'll see they're in red. Make sure and remember those, and you'll probably want to go back and do a little research on these. Extreme aloofness, social situation, difficulties attributed to deficits in theory of mind, along with deficits in joint interaction, or joint attention, and that's impaired social relationships. Communication and language deficits. Some children with autism do not speak. Echolalia is common among those who do talk, and concrete or literal processing of verbal information is common. And what I would consider some of these in this category are the what we would call classic autism. not necessarily the higher functioning autism on that. Characteristics. You have repetitive, ritualistic, and unusual behavior patterns. Some children exhibit stereotypy, which is a pattern of persistent and repetitive behaviors. Insistence on sameness. Children with autism are inflexible with routines, and I know I've had several students with autism that definitely fit this part. Many times, what I needed to do, if I knew I was going to be gone, I would make sure and let the student know a week ahead of time and make sure that they kind of knew that coming up. If a para was going to be gone, let's say the student had a para with them parts of the day, I'd make sure and do the same thing. Because even though they may have another paraprofessional with them, if they don't know ahead of time, it's going to be a very difficult day, both for the student and for anybody that's working with that student. So being sick isn't always the best thing. Paraprofessionals or teachers that work with students, they are very inflexible. If routines are changed, for instance, many schools have a early out day or a PD day where they change those days and shrink the classes from like an hour to maybe 40 minutes or something like that, and then all of a sudden the whole day is changed up. This is not, generally speaking, the best day for students with autism that are really routine oriented. Unusual responsiveness to stimuli, sensory stimuli. You've got 70 to 80% of individuals with autism react atypically to sensory stimulation. And there's also over and under responsiveness. You will want to look at that. And there's hyposensitive and hypersensitive. You'll want to know the difference between those two. Characteristics in cognitive functioning. ASD occurs across the full range of intellectual disabilities. There are deficits in executive functioning. There are about 10 to 15% exhibit splinter skills. About 1 in 10 have savant syndrome. You'll see a video later on with that. Many exhibit over-selectivity, a theory called weak central coherence. You have obsessive attention on a specific object or content. I know I've had several of the students that I work with that had that kind of perseverated on one item or another. One of my students was like trains, and anything related to trains, you might consider them the expert. They would know everything and then more. And this is where I know in the beginning we talked about students that how it could help them in part of that first chapter, objectives. Explain how some of the behavioral characteristics can become assets to the child as a learner. Think about this section here. If they perseverate on a topic that is a social studies topic that might be going on, definitely then that student is going to be an expert when it comes to the classroom when you're talking about things like that. So you can use that to the advantage. Some students are very good with statistics. So understanding what they like and what they have their intellect in and what they know a lot of can definitely be, an advantage for you in the classroom as a teacher to know that and then be able to take that into your lesson at some point. Let's see here. Some possess a strong aptitude for rote memory of certain things. Rote memory, a lot of students in this, if they get into social studies, dates, times, events, definitely would be an advantage. And depending on what career they're interested in, think about all of the great benefits that might be. Some students with autism exhibit property destruction, aggression toward others, and even self-injury. This is that challenging behavior. Many experience a variety of sleep problems. Some have extremely narrow food preferences. I know I've had some of the students that I've worked with. I had one student that all they would eat were McDonald's chicken nuggets. And So the mom would bring McDonald's chicken nuggets for lunch every day. If mom wasn't able to get there, it was not going to be a good day. So that's another one there. Some engage in PICA, which is the compulsive recurrent consumption of non-food items. I luckily didn't have a student that went through that, but that's some of the challenging behaviors that students with autism may have. There's the Asperger syndrome. Is at the mild end of the ASD. Asperger is no longer a separate category, though. It is right there along with all of the rest of them. Impairment in the social areas. Deficits in the use of nonverbal behaviors related to social interaction. No general language delay. Most have average or above average intelligence, and their peculiarities and social skill deficits make it difficult to develop and maintain friendships. Some of them don't get the innuendos. Some students may not have the empathy that you would like to have as a friend, and some other things related to social acceptance. Prevalence. Autism occurs in as many as 1 in 68 children. The rate in autism prevalence is an international phenomenon. Autism is, at the time of this book, was the 4th largest and fastest growing disability category in special education. Boys are affected nearly 5 times more often than girls. ASD appears in all racial, ethnic, and socioeconomic groups. Here's some data from 2012-2013. School year, 498,000 students ages 3 to 21 years received special education services under the IDEA category of autism. What I'd like you to do now is listen to the perspective of a teen with autism. So go ahead and pause this video and go ahead and watch the video about a young gal with autism. All right. I hope that helped you gain a little perspective from the student's perspective. Causes now. Autism is a neurodevelopmental disorder with no medical or physiological marker. In 85% of the cases, the cause of autism is unknown. There is no clear biological origin of autism in the form of there is a clear biological origin of autism in the form of abnormal prenatal and postnatal brain development, structural, and neurochemistry. Autism clearly has a genetic component. It's a combination of autism-related genes. Exposure to certain environmental factors may lead to development of autism in some children. Identification and assessment. Early diagnosis is highly correlated with dramatically better outcomes. Autism can be reliably diagnosed at 18 months of age, and they have several different screening tools that can help. There's the Modified Checklist for Autism in Toddlers, or the MCHAT. There's also the Social Communication Questionnaire, or SCQ. And then there is the Autism Spectrum Screening Questionnaire, the ASSQ, are just some of those assessments. Diagnosis for those who fail screening tests or whose parents or caregivers have reason for concern undergo a complete diagnostic evaluation. There's some diagnostic tools that are represented here. I know the school district that I work for, the Childhood Autism Rating Scale, or the CARS 2, was definitely used. There's also the Autism Diagnostic Interview Revised, ADIR. There's also the Autism Diagnostic Observation Schedule, or the ADOS. And then there's the Asperger Syndrome Diagnostic Scale, or the ASDS. There's some different educational approaches. Children with autism are among the most difficult students to teach. I would definitely agree with that. One of the phrases that I've used quite a bit is a student with autism is just another student with autism. It's not, they may have the same diagnosis or the category, but generally speaking, just because they have autism does not mean that you're going to be able to use maybe a strategy or something that you've used with another student with autism. It may work, but I haven't found it to work exactly on each student, so you're going to have to try a lot of different methods. There are early intensive behavioral intervention, the work of Ivor Lovas. There's applied behavior analysis, or ABA, which has discrete trial training. There's also some visual supports, a visual activity schedule and social stories. I know I've used this quite a bit with the students that I have worked with. Social stories help them maybe understand a little bit of how maybe they should have done, what they should have done maybe in a certain situation. Helps them maybe see a little bit more of the empathy. And then there's a visual activity schedule that can be used too as a support. Social stories are written at the student's level of comprehension and usually contain 4 basic types of sentences. They're written from the perspective of the students. There's descriptive, prospective, directive, and affirmative sentences. Constructed with 1 sentence per page and photographs or line drawings depicting key information, sometimes added. Not considered an evidence-based practice. Nowadays, there's also different apps that you can get that have different social stories that either are already there, or an app that you can actually create social stories based on maybe a certain situation that you're working with a student. There's some unproven treatment. An example is facilitated communication is a process by which a communication partner, called a facilitator, provides physical support to assist an individual who cannot speak or whose speech is limited to type on a keyboard or point at pictures, words, or other symbols on a communication board. There's no rigorous scientific evidence to support claims of success of this intervention. Parents and teachers are easy targets for interventions that promise cures. One thing I want to touch on here is I feel like this here, as much as all of the disability categories affect the families, this one here I think can have a definite change in the family, because there are times when students or children that are first diagnosed with autism at, like it said, age 2 or 3, that were just like a typical infant. There were no signs that there would be anything wrong, and then all of a sudden, around age 2, the parents will start seeing some different development. And so it's one of those things where up until that point, the parents thought they had just a perfect baby with no, with nothing wrong, and then all of a sudden they start seeing some concerns about things that are developing, or maybe in some cases not developing like they would assume an infant or toddler might develop into. So I do think it has maybe a bigger emotional drain, because up until that point, and not that I'm saying students with autism aren't perfect, but I think you can see the perspective from parents where there's, they thought at one point there was nothing to be concerned about, and then all of a sudden, within sometimes maybe a month or so, you start seeing some things that have you concerned. Also, an unproven treatment concerning a particular practice. Teachers should collect during and frequent measures of student learning to evaluate effects on students. And also, I forgot to kind of go into it, but the easy targets. There's a lot of people out there that want to give parents an easy way to cure autism. And to my knowledge, I have not seen anything that's going to cure autism, but they've been out there time and time again. And the parents out there are going to try to look at whatever they think might help their student, no matter what diagnosis they might have. Some of the things here that I put in here just for your benefit. What skills are most important for teachers of children with autism spectrum disorders? Well, first of all, you need to be well organized and task oriented to assist working with a student with autism. You need to be attuned to small but cumulative improvements in student skills, And you need to be well versed in teaching strategies, because again, a student with autism is just a student with autism. You're going to need to pull a lot of different strategies out of your hat to try to help them. The next slide has a video I want you to watch of an adult with autism. I'm not for certain, but I would assume British intent on this one here. So it seems like there's a lot of videos from that area of the world on autism and things. So anyway, take a break from me and listen to this adult with autism. All right, placement options. Let's talk about that. Students with autism are increasingly placed in general education classrooms for the purpose of improved social integration. You know, this is one of the definite deficits of many of the students with autism, is their social interaction. So they really need to be watching peers and being able to see what's going on to help improve their social integration. During 2012-2013 school year, approximately 40% of students with autism were educated in the general education classroom. So, you know, you're going to be a regular education teacher. You're going to be pretty sure that you're going to have students with autism in your classroom. 18% are served in resource room programs, so they'll be pulled out of a regular classroom and pulled into a resource room for some extra help. Maybe in executive functioning skills with the speech and language pathologist, or into a special ed classroom for assistance with some of their homework. And then 33% are in separate classes. About 9% of students with autism attended special schools or residential facilities. And of those, I would say that probably a bulk of those are, you know, the classic autism would be probably where I would say those are at. General education classrooms. Success in the general education classroom with a student with ASD depends upon the child's ability to be reliable to do the following. One is display near zero levels of problem behavior. Participate in learning group lessons. Complete assigned tasks independently. Interact with peers appropriately. Comply with classroom rules and follow the teacher's directions, and also get the teacher's assistance appropriately. Those would be the things you're going to be looking for. Resource and special classrooms. The general education classroom is not the least restricted environments for all students with ASD. Remember, you know, you're going to start out in the general education classroom, but if they don't have some of those things we just talked about in the slide before, with the problem behaviors, being able to be in group lessons and comply with rules, then that may not be the best spot for them all the time. Then there's also instruction in the resource room or special class typically features high frequency of instructional time per minute, careful specification of and planning for transferring the control of students' responses from teacher-contrived antecedent and consequent stimuli to naturally occurring events, specific strategies for promoting generalization of newly learned skills to the regular classroom and the community and the home, continuous recording of data on performance of target skills, and the daily review of data for decision making. Some of the last items, the proper placement is similar to teacher needs. Classrooms should be well organized, optimal opportunities for teaching communication skills, and varied opportunities to promote independence are also good things for you to know. The last item on this slide is Missouri compliance for autism. I'd like for you to look through that. I think at this point you can kind of understand how to look through that. There are 2 pages, and definitely look through that to get a good idea of what we have to do as special education teachers to find out and give eligibility. Then I want to go over what's due this week. So go on back to Blackboard and look at the first part. I'm going to take off a couple things that don't respond to you. So there's that. Look over the autism spectrum disorder. There's a bunch of different things. Gives you a example of a visual schedule, chat, PowerPoint. That's the book's PowerPoint. There's also what the book has for Chapter 7, good ideas. I'd probably take a look at this. Strategies for students with ASD. Go ahead and look at that document to help you understand that. There's also a sample GARS 2, and then a sample social stories and break cards. So go ahead and look through that. We go ahead and update one thing here while I'm here. That gets that. The quiz. Go ahead and get that taken care of. We're not going to do that for this class. And for autism, there will be the autism paper that's in the assignment tab. So you'll need to take care of that. Let me go here to discussion board. What I want you to do on this one is go to the internet, and you're going to, for your first post, I want you to do a little research. I want you to use the internet or asking people you know. There's a couple options. One, identify someone who has been diagnosed as being on the autism spectrum, including Asperger's, and provide a brief bio of the person and how they think their autism has given them an edge, whether it be in work, school, whatever. Option 2, identify a parent with a child on the spectrum who sees the upside of that diagnosis. Describe their situation. Get that post up by Wednesday night. Please read through the previous posts and come up with a different person each time. So, you can do research on Temple Grandin, the first one that puts Temple Grandin onto the discussion board. That's who they get to do. Do some research. Who might have autism, and who might you be able to look at on research on the internet, what it is. And so you will need to look at online first and see if your person has been already identified. I know each year I look and somebody's found a new famous person that I didn't even know had autism that is up there on the board. So go ahead by Friday, then go and start replying to your colleagues. Make sure you reply to at least 2 of them for that one there, and that one will be opened up on Monday too. As far as assignments, you've got the autism paper. It is in the folder. There is a rubric, so please make sure and use that rubric. Download it as a Word document. Make sure and put your first initial last name at the beginning, and then upload it right underneath. It's a 1-page paper. Just make sure and look at how you need to do that and get that uploaded by next Sunday evening. So anyway, I will let you go. I've kept this under 30 minutes, so you have a great week, and I'm looking forward to seeing your discussion board and seeing how your tests are.